everyone, it's Dr. Shalini Gupta at the Dermatology Laser and Vein Center, and today I wanted to talk to you about a group of procedures in the Thermi family. So Thermi is a technology, this is actually the Thermi machine here, that is able to produce RF energy, which stands for radio frequency. So we have a lot of radio frequency procedures in our office, including Exilis Ultra and Thermage, just to name a few. And then we also have the fractional radio frequency procedures. But this is a technology which allows that RF energy to be delivered under the skin with the use of a little cannula that travels right under the skin. Now it also has an attachment where we can treat the external skin, and then we can also treat the vaginal area. So I'll go over all of that with you because it's really quite a nice device that allows us to accomplish a lot of different goals in terms of aesthetics here in our office. So the first attachment to the ThermiRF procedure is something called Thermismooth. And Thermismooth is gets attached right into the machine, and this is the hand piece. Now this hand piece here has a smooth plate on it, and the RF energy comes out from this plate, and we're able to just glide it along the skin. And as we're doing that, it generates heat, and we're trying to essentially heat the skin to about 42 to 45 degrees Celsius, and then hold it at that temperature for a certain number of minutes, and it'll depend upon what part of the face or body we're treating as to how hot we want it to get and how long we want that temperature rise to maintain in order for us to get a tightening effect. So the procedure is really designed to help tissue firm up and tighten to make new collagen and give you almost instant lifting results. So let me show you some examples, some pictures of what this little probe with this little machine can do here. So this is an example of the Thermismooth procedure around the eyes. And this is one of our favorite areas to treat with the Thermismooth. We can actually treat directly over the eyelid skin. The only other procedure that allows us to do that safely is Thermage. But we can also do this with the Thermismooth procedure. And even though the Thermismooth procedure, we recommend doing a series of treatments versus some of our procedures like Thermage where you need a single treatment, the Thermismooth has absolutely no pain associated with it. You do get some heat and some warmth, but otherwise it's a very comfortable procedure. And here you can see an improvement in the eyelid skin itself, where there is far less hooding. If you can notice how much skin is hanging over that eyelid and how much tighter that is. And then also taken around the lower eyelid, you can see a nice change, brightening up of the eyes, tighter skin, years off of your age. So here's another example of Thermismooth around the eyes, and again, a noticeable reduction in hooding of the upper eyelid and also smoothing of the lower eyelid area. Another example of a brow lift, essentially with the Thermi, where it has lifted the eyelid skin. It's sort of like your non-surgical eyelid surgery for patients who prefer not to have surgery, and also tightening and smoothing of the skin under and all the way around the eyes. The Thermismooth is also awesome for the lip area. And again, non-invasive, not painful. It really helps to soften the lines around the mouth and also the nasolabial folds around the sides of the mouth here. So you can see a really nice reduction. You can also see smoothing actually of the skin and the fine lines developing on the cheeks as the technology is deployed essentially around the mouth, but then also the cheek area to give that lift to the nasolabial fold and help around the mouth area. So then moving on, we can of course use this also externally on other parts of the body, but generally when we're using the Thermi procedure for the lower face and the neck area, which is one of the most popular areas to treat with Thermi, we usually use what's called the injectable mode, where it is a minimally invasive procedure. So we just use local numbing that's injected throughout the area that we want to treat, which is usually starting at the corners of the mouth laterally and down all the way to your collarbone. And we'll use this little different attachment, which has a tiny little probe, so it's very thin, and it just goes literally through a small little needle puncture in the skin. So there are no stitches with this procedure. So once you're numbed, then this little probe will travel under the skin, and it goes very, very slowly back and forth in sort of a fan-like movement to cover all of the area that we're trying to target. And we're carefully watching the temperature that it is generating under the skin, which we usually want it to be around 65 degrees Celsius or so. And then we're also monitoring the temperature and the heat that is rising to the surface of the skin, which again, we would like to see at around 42 to 45 degrees Celsius during the procedure. And in so doing, it helps to tighten the tissue directly at its source and gives very dramatic improvements, some of which can be seen right away, but most of the changes are going to occur over a period of time. So usually around 4 to 8 months is where you'll see the best results, and they actually continue to get better even for up to a year with some of these tightening procedures like Thermi. So this is the little probe, and we can also use this in other parts of the body too, such as arms and the stomach, where if you have loose skin in any of those areas, the crepey area around the knees and the anterior thighs. It's great for cellulite. It'll literally go under the skin and heat that tissue. And sometimes what's really fun, especially if there's fat that needs to go away, we'll hear that fat just kind of going pop, pop, pop under the skin, and it's you can really tell that it's working. So it'll give you fat reduction along with skin tightening if you want that. Now let me show you some pictures of that. So this is an example of a lower face treatment. So you can see a nice reduction in the fat and also tightening in the skin and just a better, straighter jawline as a result. Here's another example of the lower face. It's like a facelift but without surgery. And the recovery time really from the Thermi procedure is very minimal. We might have you wear a compression garment for 24 to 48 hours. There's really no leakage or any other issue with the procedure. Patients can actually drive themselves home because it's strictly done with just a little bit of local numbing. And we hardly actually even see any bruising because the Thermi procedure will seal any vessels under the skin, and our anesthetic solution also accomplishes that. Here's another example of the chin and the jawline. You can see a much straighter jawline and improvement in that sagging that starts to occur in that lower face. I think that's the number one complaint patients come to us with is, I just can't stand this neck, it's starting to show my age and the jowls. Here's another example here of submental fat, and you can see both a reduction of fat and then straightening and tightening of the jawline. You can see a much nicer shadow here to the jawline. And then these are examples of ThermiRF or Thermitight administered, for example, to an area like the stomach, where we can see a really nice reduction in a little bit of the fat volume and just a real nice tightening of the skin. Here's another example of significantly loose skin here. One might think you need surgery or tummy tuck, but we can actually get fairly nice results without that aggressive of a surgical procedure. Here's another example of loose skin that is tightened with the Thermi. And here's an example of legs that have a significant amount of cellulite, dimpling, and then that loose, crepey skin over the knee, and a very significant result here. The alternative to a procedure like this would be a thigh lift, which is a lot more invasive, of course. And then this is an example of an arm with that crepey skin, and this is 6 months later, and you can see a fairly nice reduction in that crepiness, tightening up the skin, smoother appearance. So we can also use this same technology with this same probe here on the breast, and then we call the procedure a Thermibreastlift. And this is really nice because in patients who just have a bit of sagging and they just want a perkier, lifted up breast, this works beautifully. So usually the procedure, again, it's just done under local numbing. So if the area gets anesthetized, you're completely awake for the procedure, a tiny little puncture to get the probe under the skin, and I'll work from the superior part of the breast, and then I'll also work from the inferior part of the breast, and pretty much circumferentially cover the area, and we're able to get a nice lift to the breast tissue. So I'll show you some pictures of that. Here's an example of a breast in a young lady who just didn't like that they were starting to sag. And this, of course, can just happen with age, childbirth, with breastfeeding, post-breastfeeding, things like that. But you can see that the nipples are kind of pointing in an outward, downward direction. And this is after the procedure, a few months later, you can see the nipples are more pointing upwards, and there's a significant reduction in the measurement from the chest wall to the lower part of the breast. So they are tightened, lifted, perkier, patient is thrilled. So that is the Thermibreastlift. Now, we can also put a different applicator on the machine that looks like this. And when we use this applicator, we call the procedure ThermiVA. So ThermiVA is a vaginal rejuvenation procedure, again, using radiofrequency. And it is able to accomplish several things in that area. A lot of women complain of incontinence, they complain of just dryness, they complain of the tissues just being loose, and also just painful intercourse. So it can help with all of those different problems that women experience. With the RF energy, it allows the vaginal tissue to rejuvenate, to rebuild collagen, just like it's going to help rebuild collagen in other parts of the body. And it also helps to improve lubrication, and we have seen improvements also in the incontinence. And you can watch some of our other videos, but we also have some other procedures that work really well in conjunction with ThermiVA. Like sometimes we'll like to do PRP injections, where we take your own blood and collect the platelet-rich plasma, and we inject that into the tissue along with the ThermiVA, and you get a really great synergistic effect. Or we'll use something called Invagin, where it stimulates your muscles of the pelvic floor, and it's literally like doing 14,600 Kegel exercises in 30 minutes, and it helps to strengthen the pelvic floor. So we can use those in conjunction, but just even the ThermiVA alone by itself is a phenomenal procedure to help with incontinence, vaginal dryness, improving lubrication, and improving pleasure. So this is an example of the vaginal area, and this is an after image. Actually, this is immediately post-treatment, so you can see how well this tissue actually is able to respond to RF technology. It's pretty amazing, and there's no downtime. You can actually resume all normal activities immediately post-treatment. So, and then there is a final application. Well, not a final, there are two more applications, but the next one I'm going to talk about is called Thermirase. So I don't have that probe out, but it's very similar to this one. It's slightly smaller in diameter and a little shorter. And Thermirase is a procedure we can use for patients who don't want to keep getting botox injections every 3 to 4 months. So a lot of patients just don't like doing that, or they may not want to get a neurotoxin just because they're a little afraid of that, even though it's perfectly safe. But if somebody does want a more permanent or a longer lasting effect to not being able to frown and create those 11s and creases in the forehead, we can use the Thermirase procedure. And here's an example of what Thermirase can accomplish. It's almost like Botox essentially. The patient, she's trying to frown here. She's really trying hard, but that muscle's not moving, and hence she's not making those creases, and those lines are going to fade away. This is immediately post a Thermirase treatment, so it actually works instantly. Where Botox takes a few days to set in, we can see the result from Thermirase during the procedure right away. And the way it works is I mark out the cores of the nerves that are actually contributing to the tightening of that glabellar muscle. And there's an external neurostimulator that I can use, and when we pulse that over certain areas, we can watch what muscle is being twitched, and that's how you know that you're in the right area and that you are on the nerve. So first is like mapping out the nerve, where it actually is, using an external nerve stimulator. Once that has been mapped out, and we can make little dots on where the stimulation was done, that gave a positive twitch of the muscle that we're targeting. And that's important because you don't want to treat the wrong nerve, obviously. So, once it's precisely marked out, then the little probe, here's the little probe actually, will go under the skin, again, just through a little tiny needle puncture here in the temple. And when we're on the nerve, we can again just twitch it a little bit to make sure we're right on it. And then you get a treatment with the RF energy. That's a higher temperature. It heats to 95 degrees Celsius, and it's actually able to just damage that nerve. And then we'll just travel along that nerve for about 2 centimeters. We find that if we're able to treat at least 2 centimeters of the nerve, the chances of that nerve reestablishing itself is fairly low, and you could potentially get a pretty permanent result. Sometimes the nerve will kind of grow back, and if that happens, then you may have to repeat the procedure again. But there's also a nerve that comes from the inner eye area, and so we can map that out as well, and that causes the lowering of this glabellar complex here. So sometimes just treating laterally enough, sometimes we have to treat both laterally and from underneath to get that muscle to completely stop. Now sometimes we'll also be able to catch a few of the frontalis muscle nerve fibers that cause the forehead to raise up. We don't want to block that entirely, but we can usually soften that movement a little bit. And the other area that we can use Thermirase that's really interesting is for neck bands. So typically, traditionally, for something like this, we would use Botox again to just relax those muscle fibers, but we can also map the cervical branch of the facial nerve here and track it along its cores and then treat that nerve, and it'll give you a longer lasting, potentially permanent denervation of that platysma muscle, so you don't get those bands with certain movements, and it can make the neck look really smooth and give you sort of a non-surgical neck lift just doing this. And then the final application of the Thermi procedure is something called Thermidry. And again, we use the same probe that we use for the other areas of the body. The underarm area is the only area of excess sweating that we can treat with Thermidry. So right now we cannot treat, for example, palms or feet or groins or scalp. For those areas, we will still continue using Botox. But if somebody wants a more permanent reduction of sweating in the underarm area, we can use the Thermidry procedure. So basically the skin gets numbed, again with not too much numbing medicine, but a more higher concentration. Every body part is going to be a little different. And then the little probe again goes in with a little needle puncture, and we're able to heat those sweat glands essentially and disable them, and they die off, and then you're not able to sweat in that area. Now, you have plenty of sweat glands throughout your body, so just treating a small percentage of sweat glands does not mean that you're not excreting toxins or that you're not regulating your body temperature properly. Your body will perfectly adjust to it, and it's perfectly fine to not have the sweating in your underarms, which can cause a lot of embarrassment to people if you can't wear your clothes properly and you're rooting your clothes constantly and just dripping. So very gratifying, and usually the results are seen within days of doing this procedure. Sometimes you need a second procedure in the underarms if the sweating is not completely gone after the first treatment, but a lot of times we're able to accomplish an amazing result just after a single treatment with the Thermidry. It will preserve the hair follicles, so you won't lose your hair follicles. That's kind of important for men, especially if they want to preserve their hair in the underarms. For women, if you don't want the hair, we just do laser hair removal with it, and that's gone too. So that's pretty much it. Usually it does also help to reduce some of the odor associated with the sweating when we do the Thermidry, because it will get the odor glands too. So that is the Thermi procedure in a nutshell. Again, a really versatile procedure that has a lot of different applications, including the externally applied Thermismooth procedure, which we can use on the skin surface, pretty much anywhere on the body, but most commonly around the eyes and sort of that lower mouth and cheek area. And then we can use the ThermiRF or Thermitight procedure to tighten the neck and the jowls and any part of your body, including the stomach, arms, legs, thighs, cellulite, loose, crepey skin anywhere. And then the Thermibreastlift for the breast tissue to give a lift to the breast. And then we can do the ThermiVA procedure for the vaginal area, and then we can use Thermirase to give you a permanent botox-like result in the glabella area and in the neck, and then finally the Thermidry that helps with the sweating. So that is the Thermi procedure. I hope you found that helpful. And please do subscribe to our YouTube channel if you get a chance, and we look forward to giving you more information in more videos.